And we should be live, I believe. Hello, everyone, and welcome back to another session with Dental Shadowers. Today, we have an exciting session with Dr. Salman. Dr. Salman, thank you so much for joining. And on that note, the floor is yours.
Absolutely, man. Thanks. Thank you guys for having me. I was just talking to you earlier. I think this is great what you guys are doing, and it's a really good opportunity for a lot of people to just get exposed to different part of dentistry. So thank you for the invite, and I'm very happy to join you guys. And I'm going to be just getting a brief presentation here and telling you a little bit about my journey, what I do on a daily basis, what made me decide to do what I want to do, and show you a little bit about a glimpse of my day and share some clinical cases. I didn't want to go too deep, but I want to show you some exciting things. So feel free to ask any questions. I'm more than happy to answer, personal, professional, anything. I know you guys, probably going through some hard times, especially with not being able to go physically and experience those things yourselves. But let me just get my presentation here. I'm going to put it in full screen. Can you guys see it?
Yep, perfect.
Awesome. So let me give you a little bit of introduction about myself. So my name is Ahmed Salman, and I am a practicing endodontist in Denver, Colorado. And a little bit of background about my education. I am originally from Baghdad, Iraq. I grew up there. I was born and raised there. This is where I did my first dental training at the University of Baghdad. That's where I got my Bachelor of Dental Surgery. And then my family lived in Egypt for a while. So I ended up moving there because 2006 was really rough in Iraq. And I had to leave the country. So in Egypt, I went to Cairo University Hospital, and that's where I did my GPR, my general practice residency. And it was a great experience. And I practiced as a general dentist for a year. It was absolutely fantastic, but I wanted to leave the Middle East eventually. I just wanted to kind of like seek somewhere where I can advance my skills, my profession, and basically a better lifestyle. And that's when I moved to the US. And when I moved to the US, I was lucky to get accepted at University of Colorado, where I did an advanced standing program of 2 years of DDS, and I got my DDS from there. I practiced as a general dentist for a year, and then I ended up specializing in endodontics, and I did my specialty at the University of Pacific in San Francisco. And that's where I got my Master of Science in Dentistry and my certificate in endodontics. After a year from finishing residency, I became board certified and became a diplomate of the American Board of Endodontics, which is the highest level of certification that you can get in a specialty. There's only about 40% of endodontists that are board certified, and that's something that I'm passionate about, and I pursued it. And it's a rigorous process of 3-step exam to get board certified. And I got board certified last year. So, and currently I'm working at a private practice, practice limited to endodontics, with my dental school mentor from University of Colorado. He was my faculty. I was just lucky to get to work with his practice, and it's only the two of us, and we treat endodontically related procedures all day. What made me choose endodontics? Going back a little bit to when I was a kid, my grandfather was the only doctor in the family, and he was an ENT specialist. And I used to go to his office. He used to show me stuff, and I used to get exposed to healthcare. And he was a great role model in my life, and that was basically inspired me to be in healthcare. What in healthcare? I have no idea. I love working with my hands. I'm pretty artsy and crafty, so I just wanted to do something other than sitting behind a desk. So I found dentistry to become a really good fit for me, mainly because I didn't want to do 2 long years of medical school, but I ended up doing twice as much just by moving for different countries. So dentistry was a good fit for me. I loved it, and I still love it. And I was fortunate enough to get exposed to dentistry in 3 different continents, not to mention 3 different countries, between Baghdad, Egypt, and the United States. But let me tell you one thing. When I moved to the United States, it wasn't easy for me to get into dental school. I was working 2 to 3 jobs And I was studying at the same time just because I wanted to make a living and at the same time get into dental school. So it was a little bit rough. I did not get in the first year and I did not get in the second year. I ended up getting the third year. And I don't mind sharing this story. I actually start all my lectures with this story because it shows persistence. And that is key. A lot of people get discouraged when they get shut down the first time. But let me tell you something. If this is something you want and you like, you should be persistent. And it's going to be your time and your moment. And things work out the best when they're meant to be. So I improved myself. I worked on myself. And then I ended up getting into University of Colorado and I got my DDS. And after that, I practiced general dentistry and I kind of like wanted to see what I like, what I don't like. And there's a reason I specialized is because I reached a level in general practice dentistry that I felt I was getting stagnant. It was getting a little bit redundant. I was not excited and I wanted to find something that I'm excited about. I love challenges. And I just looked at the parts of dentistry that really provoked me into getting my adrenaline pumping, getting really excited about things. And those are two things. Endodontics, which is root canal treatment on my schedule, or any sort of surgery. So I didn't want to do more schooling because I've already done enough schooling. So I didn't want to go to oral surgery or anything periodontics, which is 3 to 4 years of specialty, not even 6 years sometimes. So I found endodontics to be a good fit for me, and I'm glad I chose that. It's very unpredictable. It's a challenging specialty, and not a lot of people like to do it. So to become the guy who's the expert in this, it's very, very rewarding. And I'm going to talk a little bit in details about why it's rewarding to me. So I decided to specialize. So let me tell you what endodontics is. I mean, a lot of people pretty much don't know what, and most of my patients, they ask me repeatedly, is like, so you are what exactly? So they don't even know how to pronounce the word. So endodontics is the specialty that studies and deals and specializes with the prevention, diagnosis, and the treatment of the dental pulp. The dental pulp is what for most of people known as the nerve of the tooth, okay? So I included this picture in front of you to show a tooth, okay? So the tooth has a crown portion and a root portion. When you have a decay or any irritation to the nerve, which is the essential apparatus of the tooth, it has arteries, nerves, blood vessels, everything that keeps the tooth alive and makes it responsive and functional and perceptive. Any irritation to that area of the pulp can cause either inflammation or infection, whether it's decay, whether it's a crack, whether it's any sort of trauma. So when this gets inflamed, you can't put some sort of medication and then cure it. You have to actually physically treat the canal system by removing that infected or inflamed tissue, which is what you see on the lines down the roots, okay? It's a very tiny apparatus. It requires a lot of precision, and it's a very technique-sensitive procedure. And I'll show you more in details with clinical examples. But that's basically the specialty itself. We mainly consider ourselves our dental emergency specialists because people who require root canal treatment most likely are in pain. So we are the dental 911. We are experts in dental trauma. A lot of people suffer from falling and hitting their teeth, and endodontists are the front line of saving those teeth and managing trauma properly, especially in kids, because they can suffer from developmental issues if not managed properly. And it's basically the specialty of saving teeth. That's basically what it is. So root canal treatment is a procedure to maintain natural dentition, and you get to keep your tooth in your mouth. Because anytime there's an irritation of the pulp, which is the nerve, or if there's any abscess or infection with that, you can solve that by taking the tooth out. But what are you going to end up with? A very expensive alternative, and natural dentition, despite the all good replacements, it's the best. And that's basically what entails endodontics. A little advice for college. So as I told you earlier, I didn't have a traditional path like you guys, where I went to undergrad, pre-dental, club, requirements, prerequisites, and you apply to dental school and do a 4-year and then you're done. I flew from a different country, so I didn't have to go to college. So our application process is a little bit different, but I can show and share with you some key points, in my opinion, that I think it doesn't make a difference whether you're a traditional DDS track or an international student. You got to have good grades. Let's be honest. It's very competitive. You got to keep your grades up. I mean, that's just a given. So do your best to keep your GPA up. That's the first thing that you should be worried about. Find some very valuable mentors to you. That was essential to me. Somebody who can guide you, somebody who can help you in the process, and at the same time can write you a very good recommendation letter, because those are essential in your application process. Try to shadow as much as you can. And I know through this, hopefully this can shed some light on things that you would rather do or not do. And maybe this is for you or not for you. That's very important. In my opinion, do not choose a career based on statistics or based on how much you're making or based on X, Y, and Z are doing just fine in life. You gotta like it, because let me tell you, dentistry is tough. And I'm just going to be upfront with you. I'm not discouraging you. It is a tough field. And if you are not passionate about it, you're going to hate it. And you're going to hate waking up in the morning and doing what you do every day. And that's a lot of money and time investing into this. So shadowing is very important. See if this is for you or not. Extracurriculars can be from research, can be from observation, can be from shadowing, can be from volunteering opportunities, all these kind of things. Anything that will make your application stronger, I would definitely encourage that. I mentioned persistence at the end just based on my own personal story, because a lot of people, when they apply for 1 year, 2 year, 3 year, 4 year, they end up giving up. That's not the case. Just if this is something that's sure for you, just keep at it. Eventually it's going to happen. What's my day look like? I am privileged and rewarded every day that I can help patients get out of pain, and I can get them out of pain instantly with what I do on a daily basis. That is very rewarding. Most of my patients walk into the practice, they're not happy. I can tell you that. My patients are not walking in for a whitening or a smile makeover or some veneers that they can make them excited and they're just like in a good mood. I am not a dental spa. I mainly deal with dental pain. So my patients are very grumpy when they walk in, and they can be rude sometimes. But anyone who's in pain, they're not going to be in their best behavior. But what's the rewarding part is I get them out of pain. They walk in grumpy, they get out with a lot of smile on their face. Okay. And that for me is very rewarding. I play a lot of diagnostic dilemma, which I can play detective, which I love. That's part of the challenge of it, because a lot of dental pain can be masked and overrated all over the area that patient cannot pinpoint which tooth is bothering them. So that can, with the gadgets that we have, with the experience, with the extra training, is part of the fun, at least for me. You have to deal with same day emergencies. That's a practice builder in endodontics. So I don't care if you have a full schedule. When the phone rings and there's a patient in pain and they want to get seen today, you got to manage your schedule. So you got to be on your feet and improvise, and you got to address a lot of unhappy and in pain patients and all of that. So it can be a little bit hectic and stressful sometimes, but with experience, you can handle it very predictably. Also, as a specialist and a referral-based practice, you got to also manage your referring dentists, because those dentists are humans and they also have demands and they want things to be done at a certain time and certain personalities. And establishing that good rapport will make you very successful in practice, because those referring dentists are the ones who are referring the business to you. And you got to be very clever on how to deal with that. So that's what my daily practice is like. Now, what do patients show up to my practice usually complain about? It's usually tooth pain. That's the most common scenario is tooth pain. They're in pain. They want to get it taken care of, either large decay to the nerve or like some sort of crack or anything like that. We see dental abscesses a lot. People swollen, people having an infection, people having a lot of discomfort, or sometimes even not with pain, but there's an obvious chronic, non-painful abscess. I see quite a bit of dental trauma, like I mentioned before. Skiing accidents. I practice in Colorado, so I see a lot of skiing and snowboarding accidents. And those can be very essential into management, because managing those in a timely manner can be very, very crucial in the outcome of those teeth to be saved or not. And as a derivative of trauma, history of trauma, when people were like younger, they end up having their teeth discolored. And that's also something that I address a lot. Patients are not in pain, they're not having any infection or anything like that, simply because they hit their front tooth after 10, 5 years, 8 years, they have some discolored tooth. And this can be easily managed because the nerve inside is dead and end up being discolored. So we end up doing something what we call an internal bleaching. And you can return the color of the tooth to the natural dentition's color. And that's the only part where I do in my daily practice where it's a little bit aesthetic. But mainly it's more functional, more essential work that really help people save their teeth and get them out of pain. So typically those are the procedures I do on a daily basis. I want to say about 80% of my practice is non-surgical root canal treatment, which is the traditional root canal treatment. I do some redos, some failing root canals. I don't like to call them failing. I call them persistent infections. So sometimes they need to be redone, and that's through a non-surgical approach. And sometimes non-surgical is not really feasible, so we have to do a surgical procedure, what we call an epicoectomy. And that's mainly for like cystic lesions, persistent infections that didn't resolve even after non-surgical retreatment. We go ahead and treat them surgically, where we do a small flap in the gums. We clean the surgical area. We cut the root tip, which is usually the source of the infection, and we remove the physical granulation tissue, graft it, and suture it back, and it's a very successful procedure. And again, dental trauma management, whether it's an avulsed tooth or is a tooth that's fractured, whether it's savable or not, we can build it up. May or may not require root canal treatment depending on the case. And of course, I do a lot of restorative dentistry myself. Basically, after you do the root canal treatment, you place a permanent filling to restore it with the hole that's been lost from the drilling or the decay or crack or whatnot. And I do quite a bit of that. So those are basically the procedures I do in my practice. Usually I get a case in my practice, and it's usually referred for one tooth that's causing the problem, and it requires root canal treatment. So this is basically my testing and diagnosis for every consult that I do. I do a clinical exam, as you see at the bottom left picture, where you can see a little bit of a hole in the tooth where that's a decay. And you do some clinical testing by using a vitality test, which is basically ice, to determine the vitality of the nerve, whether it's dead or alive or inflamed. And that's mainly through cold testing, percussion, and palpation. Not to bore you with the details. And then we do a radiographic examination to confirm whether there's a dental abscess, whether there's just decay to the pulp, any sort of a crack, stuff like that. So those are the main three paradigms of my exam for every consult. It's vitality test, clinical, and radiographic exam. What are the advances in endodontics? Those are really, some of them are not even new. Some of them have been going for decades, but this is a game changer in endodontics. First and foremost is the microscope. So if you see at the bottom right picture, this is what I work with every day. I work with a dental operating microscope. It can magnify up to 30 times of the naked eye. So I can see deep within the tooth of all the intricate anatomy, and I can treat them well, and I can perform my procedures very conservatively because I'm not going in blind. I can see every millimeter, every micromillimeter of the tooth, where I don't need to drill more tooth structure than I need, whether treating the root canal system or whether trying to restore the tooth itself. Microscope is a game changer, and it definitely made my back a lot healthier. Working as a general dentist, I used to work with loops, and I had to bend sometimes and get at different angles, and that was very exhausting on my back and neck. As you can see in the picture, this practitioner is like sitting in an upright position, no strain on the neck, no strain on the back, no bending. It's very ergonomic. We introduced 3D imaging into the field of endodontics, which changed the whole game. Because now with 2D imaging, you can only see this. You can't see this. But with 3D imaging, you can get a 3D image of the entire area. And it gives you a more affirmative diagnosis and treatment plan options, way more conservative, way more predictable, made our diagnosis so much easier. Newer things like dynamic navigation and multisonic irrigation. Not going to bore you with the details, but those are newer technologies. Dynamic navigation is basically a couple of lids that just gets attached to your handpiece that you drill with. And on the other screen, you can watch your 3D image scan, and it tells you exactly how many millimeters to go without you even looking at the tooth. It's phenomenal. It's a game changer. It's a lot of gadgets included in the field of endodontics, which is very appealing to me because I love gadgets. Multisonic irrigation, as the bottom left picture, this is basically a platform that hooks to the tooth. And when you clean the root canal system, you use between sodium hypochlorite and EDTA. Those are the things that removes organic and inorganic matter inside the tooth. So it's all about cleaning and killing bacteria. This is basically a tsunami of irrigation. So it creates a seal with a vortex of irrigation that goes down the roots and up and just clean it in a flushing motion. And it takes about 5 to 8 minutes to clean the tooth in pristine condition. And that's pretty much one of the latest advances. I want to share some cases with you guys just to see what is the traditional root canal treatment and what is the possibility from root canal treatment, just by showing some clinical pictures and X-rays. And I know most of you are probably not familiar with X-rays, so I'm going to try to simplify it as much as I can. So this patient presented with their chief complaint: I cracked my tooth and I'm in so much pain I can't even drink or eat anything on that side. And then, as you can see on the X-ray, if you can have any fathom like perception of that X-ray, what we're looking at, you're going to see like multiple teeth here. So there's the one, not the one that's cut off on the left, the one next to it that has a little bit of white thing on the top and a little bit of darker broken thing to the right. That's the molar. So that molar has a silver old amalgam filling that fractured, and now there's decay, which is the dark area, the black area. And that decay is getting close to the nerve space, which is in the middle of the tooth. And that's causing the patient's symptoms. So that nerve is inflamed and it needs to be removed, and root canal treatment is required. So I'm going to show you some clinical pictures of what that tooth looks like. So here you can see the silver filling very clearly, and the part of it on the top is fractured, and now there's brown stuff underneath it, which is the decay. Okay, so all of this needs to be removed and cleaned. And this is what it looks like after it's cleaned. It looks like white, nice, healthy. And then the black dots at the very middle of this picture, those are the canals inside the roots after they're being cleaned and the nerve has been removed. So it looks like a pretty much black circles. And they basically go down the root, and this is how you clean them, and you clean the root canal system. So after you clean that, you fill them with root canal filling material. And those are the orange or purple or pink dots that you can see. This is the root canal filling material. Now, what are we going to do with the hole that's left after we removed all this decay? We're going to restore it with a very nicely bonded composite filling. And before that, we just form a matrix band, and in order to reform that contact that's been lost, and we place a white filling, and the tooth is restored to function, and the patient is get to keep their tooth, and their symptoms will resolve. And this is the X-ray. This is what it looks like. You can see there's white lines inside the tooth, and those are basically the canals inside the roots that are filled. The white lines are the root canal filling material, and the white part on top is the restorative material to build the tooth up. And this tooth is going to receive a full coverage ceramic crown that's going to be done by the referring dentist. And that's how I refer my cases back to the referring dentist. And yeah, that's basically a very classic, typical root canal treatment that I see on a daily basis, about 8 to 10 times a day. I only share 2 cases with you guys. So this is one case. This is very dear to my heart. Why? Because this is basically, I show this case a lot because it summarizes the field of endodontics, because it's not only root canals. This case has a surgery component, it has a restorative component, it has functionality component, and thinking outside the box other than the root canal treatment part. So what you're looking at on this X-ray is the wisdom tooth on the left and the second molar of the bottom right of a 26-year-old patient. Patient came in complaining of a lot of spontaneous pain, to cold, to biting, to everything from the second molar. So not the one on the left, the one on the right. That's the second lower molar. There was a crack extending down the crown section, and cracks, they irritate the nerve because the tooth flexes with the crack. So it creates a gateway to air, bacteria, water, anything. Creates sensitivity because it's touching the nerve directly. Cracked teeth can be 2 parts. Either a crack that's only at the coronal part, that's restorable. You can save that too. If the crack extends down the roots, the tooth is just a matter of time before it splits and the tooth is not savable. So when I see cracks, I'm a little bit hesitant, but the patient is in pain. So I wanted to open the tooth from the inside, get the patient out of pain by removing the inflamed tissue inside of it, and evaluate the crack. So I opened the tooth, and this is, as you can see, the progression of the crack as I go inside the root canal system. And that crack was super deep that I can see it under the microscope extending all the way down the roots. And this tooth is hopeless, and extraction is recommended at this point. And that sounds like a very sad ending to what I do because I ended up losing a tooth, right? You can't save them all, but you got to be realistic. But here's when the interesting part comes in. When we looked at this case in a whole, we looked to think outside the box. So we took a 3D image of this. And you can see how similar the wisdom tooth in anatomy to the actual cracked second molar. They're very similar. So that makes it favorable for a procedure called autotransplantation. What is autotransplantation? You have a hopeless tooth that needs to be extracted, like the second molar. You extract that tooth, and then you extract another tooth and place it in its place. And then you end up replacing that tooth with their own natural dentition. And then the patient gets to save their teeth, and they don't have to go through an implant or any sort of a bridge or anything like that. It's a little bit of an involved procedure, but this is what we looked at, and we found it's a good fit for this tooth. So we decided to do that. Patient agreed to it, and this is the day of the surgical procedure. On the top picture, what you can see at the very top is the wisdom tooth. Then the one in front of it is the tooth that's cracked, the second molar, and the one with the silver filling is the first molar, just to give you an orientation. On the bottom left is after I extracted the hopeless tooth, and then I extracted the wisdom tooth and I placed it in the socket of the cracked tooth. And then I used the fiber splint on the bottom right to splint the teeth together because they're wiggly and mobile, okay? This is a picture of the cracked tooth that's hopeless, confirming that the crack is extending down the roots and it's a hopeless tooth that cannot be saved, okay? And I took an X-ray to confirm the position. You can see on the left is the area where the wisdom tooth used to be, and now it's sitting in the area where the cracked tooth used to be. And we splinted this, and when you take a tooth out, it gets severed from the blood supply. So naturally, the nerve inside will die and become infected. So you need to do root canal treatment to clean that root canal system and seal it to prevent it from infection. So that's what we did. We did root canal treatments. And as you can see, there are white lines inside the tooth. That's the root canal filling. Patient was asymptomatic after a few weeks, no pain at all. And the tooth became stable because the body heals around it and the soft tissue holds it in place. You can see dark area around the root of the tooth. That's mainly because there's no bone in there, okay? And the bone needs to be filled in over time, which is called healing. And the tooth will get integrated completely. So we removed the splint, and this is the 6-month recall. You can see very nice bone filling in, and then the patient is asymptomatic. And now this is when we recommended a full cover ceramic crown because the patient has biting issues and severe occlusal trauma. And this is the 1-year recall. The patient has their tooth, they have a crown, they're happy, they saved money, and now they don't need to go through an implant or anything like that. And this is the progression of the X-rays next to each other. As you can see, the black halo around the roots is completely resolving, and that's part of good positive healing and bone deposition, and the tooth gets to be retained in the mouth. So that's a little bit of outside the box that I wanted to share with you guys, but it's within the field of endodontics. And it's a great thing, the possibilities that we can do within this field. I want to finish up with some advice. Like I said, dentistry is hard. It's tough. If it's not for you, get out. Don't do something that you don't like, honestly. Shadow as many people as you can. Have people be genuine with you and tell you what's the good and the bad, and mainly the bad. Hear about the bad first, because if this is something you can put up with, and this is something that's not a problem to you, by all means, that's the field for you. It requires a lot of passion and dedication. And I wanted to mention the second thing is choose something that you like and love and passionate about, because I did not enjoy a lot of general dentistry, just personally, okay? And that's why I specialized. And I'm happy I did, and I'll do it all over again. Not necessarily that I'm right and general dentists are wrong. A lot of general dentists do amazing work and they love what they do on every day, and that kudos to them. What I'm trying to, have you realize here, it's a personal thing. So find something that you actually enjoy. All right. On the bright side, it's a very rewarding profession. If you like it and you like what you do, it's just almost effortless that you're going to be having a really good lifestyle, both personally and financially and professionally. It's a very rewarding. It's amazing that you do something that you like and still get compensated very well for it. And that's really the upside to it. And I gotta say, throughout the application process, when you get into dental school, if you decide to specialize or anything like that, find what you're special at. And that's coming from a personal experience. Find what you really flourish at, pursue that, and make this your angle into what you do in life. And believe me, you will flourish at that. I come from an underdog story my whole life, and a lot of people gave me doubts, and I wasn't the most brilliant academically back home. And when I came to the United States, I found out how much I struggled because of that. And I just made it my goal to flourish into my second dental training, get good grades, get recognized for what I do. And I did very well in my residency. And till this day, people collaborate with me on a lot of things. And I really appreciate that, because you kind of find your voice and you find what you're really good at, and people will recognize it. You got to just put the time, work, and energy to it. So yeah, that's really my 2 cents. And I really encourage you to ask me whatever questions you have. I'm pretty much at the end of my presentation, and feel free to give me any questions. This is my Instagram. I'm not even sure how many of you are interested into looking into more endo cases. I'm very active on Instagram. I pretty much post my daily cases pretty much every day. And I do a live podcast where I host other clinicians and we talk in details about endodontics. So if this is appealing to you, you can follow, and I have a lot of good tips that I share clinically, podcasts, and also daily clinical cases. So thank you so much for your time, and I'll be open for any questions.
Dr. Salman, thank you so much for such an informative session. So it looks like we have about 25 minutes, so I'm just going to, ask questions for the remaining of the session, if that's okay with you. And the first question comes, what's the difference between an MSD and an Endo Certificate?
So there's no difference. So when you specialize, it depends on the program you go to. Some programs offer a master's degree and some programs don't. So there's really no different other than doing an intensive research project as part of your requirement. But like I said, it doesn't make you any different from any other endodontist who only has a certificate in endodontics. It's mainly a title that goes behind your name. I wanted to do that just because I wanted another degree, and I was lucky enough to get accepted in one. So it's mainly if you're just doing more research during your program and your residency, and just the title. That's it.
I see. How long was the endodontics residency training?
Endodontic residency is usually either 2 or 3 years. My program was 27 months, so it's just a little bit over 2 years. Most of the programs are 2 years, I want to say. There are some programs that are 3. I know some schools like Harvard and Boston, BU, and I think another Penn maybe does that as well. They have a 5-year PhD endo residency program. So basically you do your residency in 2 years, but the other 3 years you work on a PhD project just to get a PhD out of it. So there are different scenarios, but I want to say on average 2 years.
Okay. So it just like really depends on the school as well.
That's right. And what you want, whether you want to apply to that 5-year program or not. So I personally did not apply to any 3-year program. I only applied to 2-year, 2-year-ish. Yeah.
Right. As an international student, how did you make your application stand out to get into dental school?
I worked as a dental assistant when I was applying to dental school. I got good grades in my exams. I had to take National Board Dental Exam, like Part 1 and 2, and get a good score in my TOEFL. Got good recommendation letters, shadowed a lot of people, did externships, visited schools, which I know is a little bit tough right now, showed my face, emailed program directors, you name it. Like I said, I applied for 2 years straight and didn't get in until the third one. So I was just basically trying to get my hands on anything, volunteering, research, you name it. You got to, nowadays it's so competitive. It's not only grades. You gotta just up your game a notch. So
Right, and like build a really good application at the same time.
totally.
Um, how did you prepare for the NBDE? I think that's the national exam, dental exam.
That's right. So for
Any advice? Sorry, go
no, that's
ahead,
okay.
please.
No,
Any
no,
advice for
finish up the question.
any advice for internally applying students now?
I'm assuming internationally applying students.
Yeah, I think so. I probably missed that.
Yeah. Honestly, like, geez, when did I get in? Wow, it's been 7 years. I'm pretty sure things have changed now, but you know what? There are so many programs. My advice: do not make the money a factor. I spent so much money on application, both endo and dental school, and it's expensive. I get it. And I used to travel and hotel. Now everything is virtual. Um, Apply to as many as you can. You will increase your chances. Just period. How did I prepare for the NBDE? There are dental decks, different study forms. I studied those honestly, and that's it. I passed both parts from the first try. I didn't struggle with that. It was just the fact that you ace an interview was a little bit challenging for some reason. Um, you just got to click with your interviewer on a personal level. And some schools require you to do a bench exam. Obviously, do well at that. But really, when the right program is for you and the right person interviews you, that's when things go right, honestly. So that's really my advice about this.
If you don't mind me asking, how long does it really take to prepare for the board exam?
Um, so I know when I got into Colorado, I see the dental students read, like, literally study for it for 3 weeks. I studied for it for 3 months, but mainly because I mean I was out of school for a little bit, so a little bit rusty, basic science and stuff like that. So I was like just grinding like a dog, just like for 3 months. I want to make sure that I want to pass this thing. Because for us, if you don't pass MBD part one and part two, you can't even apply. So I didn't want to take any chances. But I see dental students literally pass it within like 3 to 4 weeks.
Thank you. Let's see. What did you do in the interval of time that you weren't accepted to dental school? What did you do to improve your application?
Worked. I worked dental assisting. I gained more experience. Like I said, I shadowed different dentists, got better recommendation letters, contacted the programs that didn't accept me, and I told them, what can I improve upon? I remember my first year, I totally botched my bench exam, which was a clear sign of not getting in. So training on plastic teeth and cutting more teeth and just improving yourself, um, that really helped me too. So basically, just working on the flaws of the application and add as much as you can to it.
Thank you. Any advice regarding the NBDE and assistance for international dentists on visiting visa?
I think I mean, talked about this. Dental Decks, just read that. I think that's a really good source. Um, Really, I know there are like Kaplan books and stuff like that. I think it's too much. I think Dental Decks is pretty sufficient, honestly.
Thank you. What made you choose
Yeah.
Colorado for dental school?
Um, it was one of my actually favorite. I actually interviewed at Colorado twice, and I didn't get in the first time. But the second time I got in, I liked the program director. I liked the school itself. As a dental student there, you get exposed to a lot of different specialty because we don't have a lot of specialty program at the school itself. So we don't have endo, we didn't have oral surgery at the time. Now we do. We only had a perio program, an ortho program, and a GPR. So dental students can get to do a lot. Like I graduated with double-digit endos when I was a dental student, and most schools they finish with 3 or 4. So that was great for me. I love Denver itself. I think it's a great city, and I wanted to live there. And one of my best friends from back home actually went to that program, and I had to visit him a couple of times. And I don't know, he just made me love it. And it's relatively cheaper than other programs. That's also a factor, tuition wise. But let me tell you, I mean, like the year I actually got in, I was accepted in like 5 different schools. So, I mean, I ended up choosing Colorado by choice, and I'm glad I did. I think I had a really good training, overall great experience, and balanced one.
So the next question was actually asking the pros and cons of the program, but I see you already talked about the pros. Are there any cons
Yeah.
that you'd like to talk about the Colorado program?
Let me see. Um, you gotta live in Colorado. It's pretty cold. I don't mind it, but that's if that's a con. I mean, you told me that you live in Florida, so that's going to be a little bit of a change for you. Um, what are the cons? Maybe going to Pacific for my endo program where they had every single specialty. Um, I think the students can get more exposed to residency from the residents being in clinic. I think that's more of a structured learning environment, which we didn't have. We thought all of us are cowboys and we're okay to do whatever we want. And we just jump into tough procedures and don't suffer the consequences because you're in dental school. So you go in the real world and now there's a lot of things on the line and you're like, well, I did it in dental school like one time. So I'm pretty sure I'm going to be okay. So having a little bit of limitation, I think it's good. What is the other downside? Colorado's like they're not known for their big names. You know, there are some schools they have big names, right? Like you talk about UCLA, Penn, USC. Like I mean, those schools are like UOP, where I went for my residency. They have legends teaching you, right? We don't necessarily have legends as far as like known people. So maybe some people find this as a downside. I didn't. I thought we had really great mentors and good faculty, and that I learned a lot from. But yeah, I mean that will be it really. I don't think I have a lot of bad to say about Colorado.
Thank you. Thank you for being honest about that.
Yeah.
How long does internal bleaching last on a tooth, and does the color go away eventually and need more bleaching?
Nope. One and done. It's just a matter of how much you replenish that at the beginning. So you can replenish it 1 time, 2 times, 3 times until you're happy with the results. And once you put a nicely bonded restoration, that's not going to reverse. It's not going to relapse. It's not like it's an external bleach. An external bleach, you need to replenish it over time. The internal is like pretty much stays the same.
It stays there permanently.
That's right.
What's the difference between a dental microscope and I think I'm mispronouncing this, lupus?
Loops.
Loops.
Yeah. So, I wish I have. Actually, my brother came and picked up my loops. I never used loops since dental school because I work with microscope. Let me give an example. So the microscope has about 6-step magnification. The first step, which I don't even use, is an equivalent of a 3.5 magnification loop, which is most of the dentists use. I think in endodontics, it is absolutely essential. I can't practice without it. So the 6th step goes to 25, meaning 30 times your loops. So it's just basically more magnification.
Okay, I see.
Yeah.
Would you recommend students to study their graduate school in the US rather than studying outside and coming back to work in the US?
So here's what really baffles me, because I know a really good friends of mine where they went to college here in the US and then they ended up going to dental school somewhere where they're originally from, whether it's India, whether it's in the Middle East or somewhere. And then they come back and do the international program. And for me, that doesn't make any sense.
Right.
Like, I don't know what, like, one girl that I know, she told me that because I wanted to get exposed to Arabic culture and I wanted to improve my Arabic, and she wanted to like stay and speak Arabic for like few years, and that's her personal choice. Does it make sense? Absolutely not. Like, if you're planning on coming back to the US, just go through college and do your dental school here. Yes,
Because
it's more
it's
expensive.
completely different over here, the way they work things. I'm assuming, right?
Yeah. I mean, listen, I mean, Middle East, where I did dentistry, it wasn't that much different from the US as far as the dentistry itself. Is there more technology, more easier, stuff like that, gadgets? Yes, absolutely. Did we do bad dentistry? I don't think we did. I think our dentistry is up to par. But things are more advanced here. You can't deny that.
Thank you. And the next question says, can you explain more about how internal bleaching works?
So internal bleaching, let's see if I can show you a picture. So this is the cavity that you see in front of you, right? Do you see the purple, the pink dots? This is where the gutta percha is. Let's say this is a tooth I want to bleach. So the bleach is like powder, okay? It's hydrogen peroxide, all right? Or sodium perborate, whatever you want to use. You mix it with saline, sterile saline, and it becomes like a grainy paste. And that grainy paste, do you see where those two dots are? That's basically a hole, which is called the pulp chamber. So it's basically the chamber that goes inside the heart of the tooth. So you fill that up with that grainy bleach, and you place a temporary filling on top of it. And what it does, it starts dissipating through the tubules of the tooth, and that bleach starts going through the dentin and enamel and bleaches it from the inside out.
Wow.
And then what you can do is you can bring the patient after 2 weeks, remove the temporary filling, wash out whatever's left of that bleach, put a new round in, and you can do some extra bleaching for another 2 weeks. So that's basically how it works.
Thank you. I didn't even know that. After filling the root canal with gutta percha, I believe, does the tooth lose sensitivity because the nerve is gone?
Correct.
Okay.
So yeah, that's correct. So the tissue, we don't call it nerve, but I'm using that term just to make it simplified for you guys. It's called the dental pulp. The pulp is a tissue that contains blood vessels, nerves, everything. So that tissue inside is responsible for the cold sensitivity or biting sensitivity because it's irritated, it's stabbed, it's inflamed. So that needs to be removed, and it becomes like this, an empty canal space. And that empty canal space, it gets disinfected with solutions and then filled with gutta percha. And yes, that will take care of the cold sensitivity.
Thank you. How do you alter an occlusal anatomy after an auto transplant?
How do you what? I'm sorry?
Alter occlusal anatomy after an auto transplantation?
So that's a good question, because the wisdom tooth in its position when I showed you got placed into the second molar. It's not at the same angle and the same occlusal anatomy that was hitting comfortably on the tooth on top of it. So if you look at the case that I showed you on the bottom right picture, can you see how the last tooth is very flat?
Right. It's
very flat in comparison to the tooth in front of it because we take it completely out of occlusion. So that way it's not hitting in an atraumatic manner. So we take it out until it's completely immobile and stable. And then after that, when we see signs of healing on the 6-month recall, like this, we do a full cuspal coverage crown. The crown, you can customize it according to the bite of the patient. So you create the anatomy with ceramic, and that's majorly done by the lab. So then you take the patient's occlusion away at the beginning until there's healing. And when the healing shows, then you can stabilize the patient's bite and occlusion.
And if you wanted to change the bite a little bit more, would you use that tape? I believe it's called a impression tape. And then you could see where there's too much.
That's right. It's called an articulating paper that shows you if there's any heavy spots of occlusion, and you can adjust the ceramic accordingly, yes.
Thank you. Let's see.
Yeah.
Does a replanted tooth after trauma reconnect to the nerve? How does that differ from an auto-transplanted teeth not reconnecting and needing an RCT?
It's not. If it's a avulsed tooth, it's going to require RCT, which is root canal treatment.
Okay.
Yeah.
What made you decide to do general dentistry for a year instead of applying immediately for endo residency?
I wanted to figure out what I want to what I like, what I don't like. I did not know what I want to do. I wanted to practice dentistry, and I love dentistry. And for the 2 years I practiced back between the Middle East and here, I just realized that I'm probably not going to be doing general dentistry for too long, because I can tell some things are kind of burning out on me. And that's what I encourage everybody to do. Do not go to dental school, because I really don't like candidates when they come in and they're like, I'm only going to dental school to become an orthodontist. I'm like, how do you know if you're going to like it or not? Or I only want to go to become an oral surgeon. What if you do your first extraction and you absolutely hate it?
Mm-hmm.
So, in my opinion, at least practice for a year or two. Work like the least you can do is go to a general practice residency and get more exposure to dentistry, of like what's your bread and butter going to be like, and see if you like it or not. Maybe you do. Maybe you love it. Maybe you like this comprehensive family style. Patients coming in all the time. You see them. You create a connection, and you know your patients inside out, and you address their problems and have them become to a preventative mode. A lot of people love that. So you got to figure out what you like and don't like.
Right. You won't really know that until you're out of dental school. Or even,
you'll be lying to yourself.
Right. As an international student, did you get a student loan for your dental school?
Back home or in the United States?
I think like student loan in the United States.
Yeah, absolutely. Yes. Federal loans, you know it.
If you combine the endo residency, what does your career look like? Is there a way to have a career that balances clinical endodontics and research?
You could definitely do research if you're affiliated with academia, meaning if you teach. I love teaching, and don't get me wrong. I mean, pre-COVID, I work 5 days a week. Okay, I was gonna take a day off and use that day to cover clinic at University of Colorado, endo clinic. And that was my plan. I love it. It's going to be my day off, interact with students, just get to see people in clinic and all of that. I absolutely love it. I enjoyed it in residency. It was part of my training. And that was my plan. I was going to do 5 days for a year and then cut back one day and do this. But I love being a full-time clinician so much. I don't think I can be a full-time academia. But my only take on this is that if you want to balance your career between clinic and research, I know people who does it, but if you're a full-time practitioner, that's not realistic. You can't do research unless you're involved in academia pretty much part-time or full-time. So
it's hard to balance it. Yeah.
That's right.
Let's see. Did you shadow after you came to the States? I believe you said you did.
I did, yes.
Yeah,
I did.
Okay.
Yeah.
Are you happy with your life in terms of the career? Is there anything that you would change?
Zero. I'm just probably to do it sooner. I really love what I do, and I would not change it to any other specialty, just because I'm very passionate about it. If any of your audience is actually following me on Instagram, they can see that from my work, from my projects that I do on my page. I'm very into what I do. And let me tell you something, and it's not something just to give you a little bit of a positive vibe, but also at the same time is not a bragging moment, but it's a pretty good lifestyle. It's a really good lifestyle. Your back is saved. I can work 3 days if I want to and still make good money and take some time off and spend it on family and friends and loved ones and travel. Obviously not in this year, but very good career choice for me. But yeah, I gotta emphasize this. You gotta find what's right for you.
Right, everyone's different.
Yes.
Do you know anyone who did their first few years of dental school abroad and then went back to the US to finish and graduate? I think you said your friend did that.
But they actually finished dental school abroad.
Oh, okay.
So they finished dental school abroad and they came back and they did exactly what I did, which is a 2-year international program, advanced standing. I do know people who left dental school mid dental school, like abroad. They ended up going back to college and basically get their prerequisites and all of that. They validated some of it, but they still needed to go back to college.
Thank you. And then I'll do like 2 more questions if that's okay.
Mm-hmm.
How do you balance work and personal life? What do you do in your free time?
Good question. I think I was too focused on like becoming competent and efficient as a practicing endodontist in private practice. That was stressing me out the first 6 months. But then I realized so fast that you're going to burn yourself out. I check out once I leave the practice. That's it. No dental talk. That's it. So let me tell you what I do. I work out every day. I play tennis, soccer, and basketball 3 times a week. And I use my weekend accordingly. I spend my time with my family. My family, they all live here, so I go visit them on Friday. I catch up with them. It's a good family time. Saturday, I spend it with friends, whether it's brunch, whether it's an activity, whether it's something like that. And that's how I spend my Saturday. My Sunday, I get to relax. It's some me time. And that's how I do it. And in 2019, I used to travel every 3 months. So every 3 months, I will take Friday and Monday off, and I'll pick a weekend and travel somewhere. And I do at least 1 long trip a year. And that's basically the main balance, in my opinion. You got to travel a lot. You got to take care of yourself, spend time with family and friends, and do not make your life all about dentistry all the time because you're going to get burned out.
For sure. That sounds like a great lifestyle.
It is a great lifestyle.
And the last question, on average, how long does it take to pay off dental school loans? And I'm assuming that really depends on the specialty, right?
It depends. It depends on how much, honestly, and how much you're making, right? Like how much you have in debt and how much you're making. It depends on where you got accepted. Like if you go to USC or NYU, you're gonna finish with $500,000, right? If you're doing like 4 years, and that's pretty much like on average. Okay. Also, it depends. Do you want to? Some people just pay it off in 25 years. They don't care. They just do an income-driven plan. It becomes part of their bills for life, right?
Right.
And some people are very OCD about paying it off super fast, like 5 to 10 years, because they have other goals. They want to establish other businesses. They don't want to do dentistry all the time. They want to like retire early and have businesses, and they generate money for them. If you're planning on being a clinician for the rest of your life until you're retired or until you're able to, let it be until 25 years, income driven, whatever it is, you know? So it depends on how much, honestly, and how much you're making. Like there's like, in dentistry, you can make between $80,000 a year up to $1 million. It depends on what you do and how much do you want to work and what your lifestyle is going to be in the first 5 years. Do you want to buy that Porsche and get that nice house? Then you're not going to pay off your loan that fast. So it depends on what you want. If that's what you want, that's okay. Your loans are just not going to be paid off in 5 years. So it really depends on what you want. And if a lot of people are okay with not paying their loans for another 25 years, and that's completely fine. They live a good lifestyle and they just enjoy their money on something else. And life is too short not to enjoy it. So it really depends on what you want.
Well, Dr. Salman, it was a pleasure having you. Thank you so much for joining and you're answering questions, presenting cases and everything. It was very informative. And thank you everyone for joining. Tomorrow we also have a session, and the attendance quiz is also going to be sent in the chat shortly. It can also be found in our link tree in our Instagram. Thank you everyone, and I hope you have a great weekend.
Thanks guys. Have a great weekend.